Welcome back to Prime Morning, and this is the point where we say that, in fact, this is the point where I ask you, have you already sent in your messages, your questions about the conversation we're about having during the Good Living segment? It's time for Good Living segment, and we gave you a hint of what the conversation would be, and we're going to talk about traditional first aid. Yep. What is it? What are the principles surrounding traditional first aid? And so get ready to learn a lot during this conversation, so start penning things down. My name is Asieduwaa Akumia, and my guests for Good Living segment today are in the person of Dr. Mavis Boakye Yiadom. She was here last week, and she gave us some really key things when it comes to identifying certain plants that you might have just been seeing in the bush somewhere and not necessarily knowing exactly what they do. So last week, if you didn't watch, you missed out a lot. She's the head of Clinical Research Department Center for Plant Medicine Research. Good morning, Doc.
Good morning.
Good to see you again.
Good to see you too.
Last week, it was really fun. It was really educative. Yes. And I believe that this morning would be no exception as well.
We hope so.
And our gentleman, Dr. Boakye Yiadom and myself had decided to sandwich Dr. Kingsley Attuah, who is the acting HOD of Clinical Research Department. Good morning.
Good morning, Asieduwaa. I'm doing well, and you?
I'm doing awesome.
Good.
And I'm happy about we continuing the conversation. So last week, like I was telling viewers, we started off with identifying some plants, and Doc and Tony were here last week, and some of the names they were mentioning, Rosalind and myself were quite lost. But at the end of the day, we were aided with pictures and exactly what they do and all that. So it was very educative. Now today we are going to talk about traditional first aid. So we're going to first start off with what first aid is.
All right. Thank you very much, Asieduwaa, and good morning to your viewers. Happy Ghana Month.
Yeah.
To them.
Happy Ghana Month as well.
What is traditional first aid?
Yeah.
If you look at the word first aid, it simply means the immediate and initial treatment given to a person at the point of injury or illness before medical treatment arrives.
Okay.
So this window period is so important to keep your patient or client who suffered the injury or illness stable till professional help arrives. So it's very important to know what to do when you are faced with such an issue or a predicament. And then you must ensure that you follow certain principles so that you don't endanger the life of the person you are seeing to, and then you also help yourself. Because sometimes in trying to help someone who is injured or ill, you might
make it
worse or injure yourself too as well.
So sometimes you might think that, you are privy to certain plants or certain medicines.
Exactly.
And so you can just administer it just because it's available. But you could be wrong. Whereas, like I said, this is where you have to really be glued to your seat and start learning. So now let's come to the principles that you mentioned surrounding first aid, traditional first aid.
So traditional, before Western medicine came in, our forebears were practicing certain procedures. For instance, someone gets an injury or loses consciousness. They had certain herbs they were using to help keep the patient conscious or keep them alive. But over time, through research and scientific process, we realized that even though these practices were not bad in itself, we've refined them a bit. And so I would like to go through one by one so that anybody who is faced with an injury or someone who needs first aid will not falter. One of the first principles is to ensure the safety of your patient or yourself. For instance, just as I was crossing to come in, let's say someone gets knocked down by a car. You don't stand in the middle of the car road to attend to the person or give the person first aid. You must ensure that you move the person to the sidewalk or a safe place. You must ensure that there is no immediate danger around you. For if you are in the farm and someone gets bitten by a snake, you don't attend to the person there and then. You move the person to a safer place away from the point of danger. And then you can administer your first aid. It is essential that when you've moved the person to a safe place, you must call for help.
Okay, so speaking about the whole snake bite thing, right? If you're moving the person to a safe spot, wouldn't that not be wasting some time?
No.
Because what some of us and myself, what I know is that when a snake bites you, you know, the poison starts moving. They say it moves before it gets to the heart. So some will have to tie a belt or get a cloth or something and tie exactly where the bite is and all that. So won't you be wasting time?
No, you won't. Let me...
Yes, please. Yes.
Just as we say in tree.
Aha.
One, where you're standing, is it safe for you as the person who wants to save the person?
Okay.
So you cannot be at the same spot. What if the snake is still around?
And bites you as well.
So that's the whole thing.
Okay.
You need to move the person to a right place so that you could all be in safety. And then you could administer whatever help you want to administer.
So there's nothing like time wasting over there?
No, no, no.
Oh. Okay, so viewers, there you have it. There's not like time wasting over there. All right, so yeah, Dr. Attuah.
All right, so to continue from there, once you have moved the person to a safe place, you call for help. Assuming we are here, someone gets a stroke, someone loses consciousness. In trying to revive the person, if you don't call for help, you die quickly. So it's essential to call for help. For instance, we are administering someone's lost consciousness, we are trying to compress the chest. Within 2 to 3 minutes, you get tired because it's a very, very tedious process.
Even with that, some do it wrongly.
Exactly.
Yeah.
That's why we're here. So in following the principle, move your patient to a safe place, call for help, and then you now get to attend to the patient or the person who needs help. Now, when trying to, you yourself should be skilled in what you are doing because you cannot give what you don't have. So if you don't know it, call for help from someone who knows how to. Or the best you can do is to put the person in what we call the recovery position. So let me use your pillow.
Yes, please.
If there's the head of the patient lying flat facing the sky, what you do is to move the person to the left side. Okay, so you move him onto his left arm so that he doesn't swallow the tongue or doesn't choke his airway. So you turn the person gradually. So you can move the arm across the chest, bend the knee too, and then you move him gently.
Why not the right side?
The idea is to prevent him from swallowing things and also to slow down what we call gastric emptying. When you're on your left side, your stomach doesn't empty quickly, unlike when you're on your right side. So that is scientific.
Please repeat that. Please repeat that. That part needs to be highlighted.
So what I'm saying is, in moving your patient to what we call the recovery position, it's essential to move him or her gently to your left side. It helps to reduce what we call gastric emptying.
So not to your left side, but
no,
the patient's left side.
Left side.
Right.
Yeah. It's been found, for instance, someone swallowed poison. On that position, it's been found to slow the rate at which the content in the stomach enter the small intestines. So it's essential to put the patient in that position to the one who knows how to handle the patient or the medical help expert comes, and then they continue from there.
I think we've already started with what exactly you can do. I think, first, get a safe spot. Secondly, is to move your patient onto the left side. It will slow down. So let's say, that's just a for instance, if let's say there's a poison in, that has been administered into the body or something like that, maybe a snake bite. That's an example, right? Yeah. You move them to the left-hand side. Oh.
And then you call for help.
I'm excited where this is already going. I'm excited. Okay. So now, are these all the principles, just that? What other
there are more.
There are more.
Okay. These are just the basic
ones.
So usually that's what you would go out for, depending on what exactly is happening. Then when you have found that safe position, you need the help. If you are the skilled person, then depending on what is happening, then you give the needed help. So it depends on whatever the person is having. So generally, I saw somewhere somebody was asking about what if somebody have a headache.
Yes.
And then I'm like, headache is not something that we should be looking for a first aid. But then, because there are a lot of causes for headache.
Okay.
So the first thing that comes to mind is what might be causing the headache the person is having. Is it stress? Usually, stress can let you have headaches. And so if it's a stress, then the first thing you think of doing is how to calm the person down so that the person can have a bit of rest.
Okay.
Especially for those of you who stand a lot, you move around because you come in early and then you might not have the chance to really sleep well. So the first thing I'll think of is the person stressed out? So then I need to let the person have a bit of rest. I remember when we were in school at a point, one of us was like, I'll give the patient rest. And we're like, how do you give the patient rest?
Okay.
So usually if there's a resting place for the person which is needed, you find that resting place so that the person can relax for a while. The other thing is if the person is...
Please wait. So you don't have to rush.
Not
take
at
a
all.
painkiller.
Not at all. Because it could just be, it's just stress. Somebody has headache. It's just stress that is causing the headache. So if it's just stress, you don't need a painkiller. The person just needs a bit of rest to recover.
Right.
Then the other thing is if the person is dehydrated.
Okay.
Sometimes when people get dehydrated, they can also get headaches. So the person hasn't drank water in a very long while. Mm-hmm. So if that is the cause, what do? Get some water for the person, take a bit of water. And if the person sips the water gradually, the person recovers. The person doesn't need any painkiller to get that headache off. Then the next thing I would talk about is the person hypertensive? Have you checked the person's blood pressure to know what exactly is happening? Because the blood pressure can also cause somebody to have a headache. So if that is the cause and then you give a painkiller, you have not resolved the problem. So what are the instances that is causing that headache? Sometimes even hunger.
True.
And
that happens to me a lot.
Because when people are hungry, you usually get headaches, some bad, terrifying headache, and you're wondering what's causing this kind of headache. But it's just that you're hungry. You just need food.
Just eat food.
So I still remember when we were young, there was this book that somebody collapsed and he was like, they were like, let's pour water on him, let's pour this on him. And they were doing all sorts of things. Then somebody said, let's give mashke. Kenke. And the person who had collapsed just said, listen to what the other man is saying. So maybe you just have to listen to what the other man is saying. You just need something with sugar a bit to help the person up. So basically some of these things come up and it's something we need to look up to. It's not just when the person comes in, I have a headache, you go straight ahead and do
say,
something.
Take some painkillers.
Yes.
Stomach ache.
So somebody with a stomach ache, it depends on, like I said, the cause of the stomach ache. The whole day has a person eaten. That is one thing. The person hasn't eaten anything at all. So the person comes up with a stomach ache and you think because there's an ache, you just start giving medication for that. No. Does the person need a bit of water? Does the person need a bit of food, a bit to help the stomach to recover a bit? Sometimes, because the person hasn't eaten for a long while, maybe there's acid reflux. So if that is it, then we need to give something to prevent that. In traditional medicine, something that usually we use for acid reflux is guava leaves, the local guava leaves. Okay. We call it Asieduwaa guajava. I think that's one you can easily get because the name is very close to guava. Asieduwaa guajava.
Last week. Okay.
But even
local guava leaves.
Local guava leaves. Okay. It doesn't mean go and pluck the whole leaves from the guava and then go and take
from last week we learned that if you do that, you'll be making a terrible mistake.
Exactly.
Because the fact that it can cure this does not mean that you have to take the whole sum of it and then apply it. So please, we need to be very mindful of that. Yeah.
So if usually it's the fresh leaves that have come up, that is usually used. If you can get the fresh leaves, that's the best. Okay. If not, just a few 5 leaves could do. You can just boil it over and then you take it as a drink. Seriously, we don't need much when there is that. And after you have given that and the person calms down, then you need to find out what exactly is causing the stomach ache. The other thing is that we will say, you are saying stomach ache, but then for us scientists, we know that this is not your stomach, this is your abdomen. Yeah. So the stomach, it's inside, there's a part of the intestine or the gastric thing that we know that this part is called the stomach. So this whole thing is the abdomen. So when somebody comes to the hospital and like, I have stomach ache, we will write abdominal pain. Yeah. So this is the differences. So then somebody is having abdominal pain, like we would say, and then we don't really know where exactly the pain is.
Yes.
the first thing as doctors or as medical practitioners, what we do, or as herbal practitioners, is to find out where exactly is the pain. Okay. Where exactly is the pain? My abdomen is hurting. Is it up? Is it down? Is it around the navel?
So all of here is the abdomen?
Abdomen, yes.
And there's just the upper and the lower?
There are lots. There are about 9 regions.
Oh my God.
There are about 9 regions. So in all the regions, there are certain organs that are found in these regions. So somebody is complaining, I have stomachache, and then all of a sudden you think that, oh, because the other person came in and I gave maybe something and it helped, let me also...
It could be the same for you.
It might not be the same.
Okay.
So that's why usually when you come to the consulting room with us, we would ask you where exactly is the pain. So use your finger to show us where exactly you feel the pain. So when you show us, then it will help us determine what exactly the problem is. Then that would even help us determine there and then what we could give you before we give the main treatment.
For somebody who eats, okay, you eat around 11, let's say 10, 11 p.m. I mean, the whole day, which I didn't eat what bread, and this is the time that you've had the opportunity to eat something because you're now home. And then you eat, you know, walk around a little bit, and then you go to bed. And the following morning, you wake up, and it seems you're having this tummy, fine sort of visa. So in that situation, I know that it happens to quite a number of people out there. Is that stomach ache, or could probably be something else, maybe from the time you ate the previous day? In a situation like that, what could you possibly do?
All right. So, like my colleague rightly said, you need to identify the exact location this is. So, we are studying traditional first aid.
Yes.
At home, what do you have that you can use?
Okay.
So one of the easiest things to do is just get a warm glass of water and drink. Because it's been found that when you drink warm water, it dilutes the content in your stomach. So for us, when you've administered this, you get some relief. You can then walk into the hospital and then we take care of you. But if that doesn't happen, it means that we need to now come and examine you. The abdomen is divided into 9 regions. I used to having it just below the chest, on your flanks, in the center, at the lower part of where. Then from knowledge of the anatomy and the physiology of the human body, we can say, okay, this is ulcer or this is just indigestion, and then we administer the right medication.
Okay.
So around you, when there is no doctor, what do? Get a warm glass of water. If you have guava in your house, like she's saying, you can boil a cupful.
That's a leaf?
Yes.
Yeah, right. Exactly.
Okay.
Yeah.
That's guava leaf.
Okay, all right.
Yes.
All right.
It's also been found when you're hard pressed and you have something like pawpaw.
Pawpaw.
Unripe pawpaw, or slightly ripe, has what we call papain in it. Papain has, it's a compound in the pawpaw fruit itself. It helps to lower the acidity of the stomach. So I'm not here to prescribe medications, but I'm just trying to teach people that just before you meet the doctor,
These are some things around you that you could use. Doc, is it true that pawpaw seeds are dewormers?
Yeah, it's true.
It does.
It's true.
It has that.
Effect, yeah.
Okay. So it's advisable. Well, seeds no dorsal or pawpaw, you know, because people are over chew.
So we go back to last week.
Yes.
You don't chew too much.
Okay. Exactly. So the pawpaw seeds, yes, I won't say it, but please don't chew too much. Or, right?
That's it.
So speaking about the same pawpaw, right? When you take 2 ripe pawpaw, for instance, I can't take the not too ripe pawpaw. I like it very soft and, Would I be losing something like the papain you mentioned? Would I be losing it? No, it will still be there.
Yes.
Okay. Speaking about the abdominal pains, okay, I know that there were somebody did mention that if your stomach is hurting or your abdomen is hurting and you feel like, you know what, let me just throw up, but it's not coming. Some will tell you drink palm wine, it will force it to come out.
Well, let me take this.
Yeah, please do.
I've had incidents of meeting patients who've swallowed poison, swallowed all sorts of things, and they are asked to drink palm wine to induce them to vomit. Frankly speaking, it is not the best practice. It is not at all, because palm wine has some form of alcohol in it. And in every plant, in every poison, in anything you've ingested, alcohol.
Did I say palm wine?
Palm oil.
Palm oil.
Yes.
So palm oil. Sorry, pardon me. I meant palm oil. Yeah.
So the alcohol will help move whatever it is better if it is palm wine. Now, if it is palm oil, we've also realized that it is also a chemical compound. Palm oil is an oil. So it is able to absorb certain things from what you ingested and move it into your bloodstream quicker.
Okay.
So as much as possible, we advise that you try and get the person to the hospital quickly. Palm oil is not the best solution all the time. I've had babies like 3 months old, 6 months old at the ER who are rising, they've swallowed, Parazone. And parents have given them palm oil. That is the worst that could happen. Yes, it's not.
Okay.
Yes, we classified these things that poisons that people ingest into two main groups, whether they are basic or whether they are acidic. So if you don't know these two basic compounds, the group they belong to, and just push in palm oil, you may either be aiding the poison or whatever it is to spread into the bloodstream more.
So in a situation of poison, what can you do as a first aid? Just about last week, I had a friend, sister-in-law, who was bitten by a scorpion. So in a situation like that, what can you do quickly, maybe in your kitchen or something, before you get the person to hospital?
The first thing, would you like to take?
Yeah.
The first thing to use, and it's always available, is water.
Water?
Yes. Water is best for every form of emergency that you may have, because it is innate and it is neutral. So what happens is that you are washing off the poison. So if they've been bitten by a scorpion, you wash off the spot as many times as you can. If you've had a burn, you can wash off as many times as you can. Let's say you're in the kitchen.
Oh, with water?
Yes, you need to lubricate the spot. You need to. So you wash it.
You know, I've had burns before. Yeah, Dr.
So I
Boakye.
think for burns, yes, you can use water, but then the tendency for somebody, when the person is using water to rub. Is another thing. So what rather you do, especially if you're in the kitchen, salt. So the first, and as soon as it happens, you put salt on it. That rather wouldn't let you rub it.
Yeah.
So it's either for burns in the kitchen, and in the kitchen you can easily get salt because salt is easily available. Yeah. Put salt on before, even if you want to put a little water, you can, but then it won't let you,
or the
whatever. Salt is salt.
Okay.
Just put it on. Okay. The other thing you can use is egg white.
Egg white?
Yes. So when you break the egg, not the yolk, the liquid white on it, when you get that burn, as soon as you get it, just put the egg white on.
Okay, so Doc, hold that thought. So some years ago, all right, my parents are watching, they know this story. Some years ago, our house help accidentally poured hot water on my chest. Oh. So because I was quite little and the reaction, immediately I rubbed my chest because I was feeling the burns. Yeah. And before I realized the skin was all off and everybody was just confused. So immediately, my uncle, who is a doctor, was called and he said tomatoes should be placed on it. And before I realized it was helping. So what exactly does the tomato do?
Let me say, it soothes the spot because tomato has a lot of water in it.
Okay.
So what you're trying to do is that when you get burns, your body is trying to release the heat that is absorbed. So you need something to soothe in the place. Okay. Tomato is fine. If you have aloe vera around your house, you peel and then use the juice, that's soft jelly on it. You see, you want to keep, we have what we call homeostasis. You want to prevent the body from losing too much heat and from gaining too much coldness. So you are just trying to soothe in the place so you get the immediate help and medical help that you need. So tomato soothes the place for you. It has what we call lycopene in it, but lycopene has other medicinal roles we don't want to talk about today. But that is the primary role. That
I mean, it did help because today when I look at my chest, it's like, I can't find anything. Luckily, it really did help. So aside burns, what other thing would you want to touch on briefly, quickly?
All right. There's this one very close to my heart. The first one I've spoken about is the burn. When someone is burning, please don't let the person roam around. Make sure the person rolls on the floor so that any cloth that is burning is doused. You need to put it off. So if, let's say there is a burn and you're around, get the person to lie on the floor
and roll.
And roll
So
around.
as in if the person catches fire.
Catches fire, yeah.
Because,
yeah.
so-
Okay.
If the person catches fire.
Catches fire.
Now, when the fire is doused, whilst rolling on the floor, you're sure that he's at a safe place, then you can attend to the person who has the burn. I've seen people pour on palm oil. I've seen people pour on
anything they can get.
Yeah.
Anything they get.
Water, sand. Yeah, sand is very common,
Most of
actually.
them.
Sometimes you need to keep the person sterile. Try to prevent infection as much as possible. So let's reduce the amount of, some people use gutter water, some people use leaves from anywhere. Yes. Yeah, so that is close to my, we lose a lot of burn patients because the initial first aid is poor. So please, if someone gets a burn or catches fire, roll on the floor, douse the fire.
Don't run around.
Don't run around.
Don't let the person run around. Yeah.
Don't run around. And then that one is the other one I want to talk about is the injection of poisons. Please, the palm oil.
Yeah.
It's a necessary evil, I know, but let's limit the amount of how hasty we are to give palm oil to.
Yeah. Okay.
Some people grind charcoal and then mix it with water and drink. That is a bit okay. That's a bit okay because charcoal is also in there and then it's able to chelate whatever, we call it chelation. It holds on to the poison or the substance the person has drank. But again, let us not be too hasty to give this. You need to assess the person first. And when you've assessed the person, you know that, okay, let me give this or let me give that. The last I want to talk about, but not the least, is unconsciousness.
Okay.
Yes, someone loses consciousness. We don't bundle the person into a taxi and just rush. No. Like I said, move the person to your left side. Make sure it's not swallow the tongue. In first aid principle, we have something we call as easy as ABC, the airway. That means where the air is entering the person's lungs. Is there anything in the airway? I was in the ER when a child was brought in drooling. The mother didn't know what the child had taken and kept giving the child palm oil. Only for us to rush the child to the x-ray room and realize that it was a pebble, a stone. So all the palm wine was rather sitting on top of the stone and preventing the child. So he was really short of breath. So we were trying all the maneuvers we know. We were squeezing the abdomen, patting him on the... Then we realized they kept moving. So an elderly medic came on the scene and then was able to take it out with the help of the anesthesia team. So what we are saying is let us not be too hasty to administer homemade or local products, but we need to assess our patients very well before we
All right. Doctor, so we are definitely going to continue this conversation next week, Tuesday, because unfortunately we are pressed for time. But quickly, you see, there are a lot of accidents, people. The first one that you mentioned, moving the patient to the left-hand side, is this something that people can administer? Anytime you chance on an accident scene and then you see people injured and all that, could you do that?
Yes.
Okay.
Yes.
So viewers, there you have it. There you have it. For those of you that chance on accident scenes with people injured and all that, the first thing that you should do, instead of leaving them to lie on their backs and all that, you should try and let them lean over to their left-hand side. Thank you so much for your time. This has been very educative. Next week, Tuesday, we are going to continue this conversation. And so, and we'll try and read your messages as well and answer all your questions. Thank you so much. So my guest for Good Living segments have been Dr. Mavis Boakye Yiadom, Head of Clinical Research, Department Center for Plant Medicine Research, and Dr. Kingsley Attuah, Acting HOD, Clinical Research Department. Thank you so much. Have a lovely morning. Viewers, like I said earlier, MOG is in the building, and Rosie Felly will be seated with him. My name is Asieduwaa Akumia. Stay tuned.